Hello, my name is Shelby Corker, and this is my newborn assessment. This is my newborn Chip, and we are going to be assessing him today. The first thing I'm going to do is I'm going to look in the chart before I go inside the room to see what type of delivery this baby had. If they were born via C-section or if they were a vaginal delivery, if there was any complications during the pregnancy, like gestational diabetes, hypertension of the mother, any placental issues, or if there's any genetic issues that they found during the pregnancy. When I come in, I will introduce myself to mom or dad and tell them what I will be doing with the baby. That will be checking the baby out and assessing them. I will use age-appropriate and educational level appropriate language to communicate with them. And I will also maintain safety and privacy. I will also do a two-patient identifier after I wash my hands and promote privacy by closing the door or closing the curtain. After figuring out the birth history, I will look at the baby. The first thing I will do is take vital signs. I will take axillary temperature right underneath the armpit. And I will take pulse by listening to the apical pulse on the chest. And then I will do respirations by placing my hand on the chest and feeling how much the chest rises and falls, if it's irregular, if it's regular. A normal newborn pulse is 110 to 160, and then normal respirations is 30 to 60. They are predominantly nose breathers, so I will check nose patency as well when I check the breathing to make sure that both nares are patent. Second thing I will do is I will take my tape measurer and I will measure the circumference of the head going across the brow and around the head. Then I will take chest circumference going across the nipple line and around. The head should be bigger than the chest. I will then take length by going from the top of the head to the bottom of the foot, the heel of the foot. And then I will look at the general appearance of body alignment, if the baby is flexed or relaxed and limp. I will assess cry, if they have a good cry, and the skin color, if they have bluish extremities and a pink body, or if they are pink all around. That deals with perfusion and circulation. I will also look at the skin for vernix, milla across the nose, and I will educate the parents to leave that alone. Don't pick at it, it will go away on its own. Lingual, the hair on the body, this baby has a lot. Rhythmia, toxicum, Mongolian spots, predominantly on darker skin tone babies like African American and Asian babies. We will really look for that and document it because it can look like a bruise. We will also look at petechiae, little pin needle red spots to make sure there's no broken capillaries going around. After we assess the skin, we will look at the head again after measuring it. We will look at the fontanelles, anterior and posterior. We want to make sure there's no bulging or that it's not depressed. Depressed fontanelles can be dehydration. Bulging can be a bad sign too. We're going to look for molding if it was a vaginal delivery, because the head can be a little misshapen due to the squeezing of the skull to fit through the vaginal canal. There's any cephalohematomas from either suction or the forceps, and then caput cecatum. With the face, we're going to look at symmetry, especially on the eyes, the nose, the mouth. Make sure the muscles move symmetrical. We're going to check the ears for symmetry and make sure they're well formed. If they're not formed all the way, we will document it. We also want to make sure the eyes are aligned with the ears because it could be a genetic abnormality if the eyes are not aligned with the ears, if the ears are a little bit lower set. We will also check eye color, if Perla is there with the pupils. If they're equal, round, reactive to light, and are accommodated. You can't really tell accommodation in a baby yet because they don't really focus. But you also want to check for strabismus, a lazy eye, when they're looking at you. You also want to note the iris color and the conjunctiva, if anything's going on with the conjunctiva. Especially since we want to monitor, even though we give the erythromycin in the eye when the baby's born, we just got to keep watching, make sure nothing's going on there. Nose, we already checked the patency. When we get to the mouth, we're going to feel with a gloved hand the palate to make sure it's intact and that we don't have a cleft palate or any holes that will affect feeding. We will also check for Epstein's pearls. They're just calcium deposits, and we will inform mom and dad that they will go away on their own. We will also assess the suck-swallow reflex. I'm sorry, buddy. And make sure that is intact, that the baby can eat and is eating appropriately. We will also check the neck and make sure they have clavicles and make sure they have a neck. Just checking the skeletal and the muscle tone. With the chest, we want to make sure that the chest is rising and falling symmetrically, that one side isn't lifting and the other is not. Make sure everything's symmetrical with the nipples and the chest. With the nipples, we're going to assess the size. If they're really, really small, it might be indicative of a preemie baby. If they are engorged, or if there's extra nipples, that can happen. We will also auscultate breast sounds. It is normal within the first 24 hours to hear crackles or fluid in the lungs because they're still learning how to breathe and they just came from amniotic fluid where they were encompassed by it. So it's going to take a little bit to get that out. If you hear it after that, that could be indicative of a problem. We'll also check the apical rate. With listening to the heart, we want to make sure the rate is regular and that we don't hear any adventitious sounds. With the abdomen, we're going to inspect it, make sure it's symmetrical. We're going to check the umbilicus to make sure there's 2 arteries, 1 vein. And we're going to auscultate it for bowel sounds. They should be present after birth. We're going to also check frequently for voiding patterns. We're also going to check the genitalia to make sure the anus is intact. Make sure it's a working anus because there can be cases where it's just closed. We want to make sure the baby can void. We're also going to check for meconium to see if they have their first bowel movement. For the females, especially, we're going to check the genitalia to see if the labia covers the clitoris. If it does not cover the clitoris, it could be indicative of that is a preterm baby. Term babies, the labia covers the clitoris. And it could, preterm babies have like more smooth labia and does not cover it. Male, we want to check the meatus location, make sure it's not under or to the side. We want to make sure that it's center of the penis. The testes location, if the testes are outside of the body, and make sure that there's 2. Make sure there's none floating up in the pelvic cavity. We will also check the skin there too. It can be the same with females, that it will have rugae. If it's a term baby, if it's a preterm baby, it'll be smoother. We would also discuss if they wanted to circumcise the baby and care for that if they chose to, if they had it done. The extremities, we want to check the equal muscle movement, muscle tone, count all fingers and toes, check range of motion, and for hip dislocation, we would do the Barlow and Ortolani. Ortolani is going to the side, Barlow, and it'll click out. Barlow, you bring it back in, and it will pop back in if it is positive. With the back, the vertebral spine, make sure there's no columns or a hair spot at the bottom of the spine, be indicative of spina bifida. Also check to see for a patent anus. For the reflexes, we will check molar reflex, tonic neck, where they catch themselves, palmar, where they grasp your finger, Plantar, their toes will curl around your finger. Rooting, you will just kind of rub their face like this, and they'll turn to root. Sucking your fingers, swallowing, you assess that during feeding. And stepping, we will pick them up like this safely, and they will take steps across as you hold them like that with their feet on the ground. We will also check Babinski, where we stroke the bottom of the foot. Let's get Chip to show you. Stroke the bottom of the foot, and the toes should flare. You will stroke the outside of the foot, and the toes should flare. That is normal for that age. And we will also check for trunk incubation, behavioral state, deep sleep, light sleep, drowsy, quiet, active and alert, or intense crying. If they have a shrill cry, it's good that they're crying well, but it could mean some other things. But after our assessment, we will also make sure that baby had received their vaccines, and educate mom and dad if they chose not to at this time, to make sure they follow up with their pediatrician. And after that, we could also assess feeding on mom if she is breastfeeding, also how mom is doing it, and make sure the latch is good. But after that, we will let mom and baby rest. And that concludes the newborn assessment with our good newborn Chip. And I will wash my hands, do my conclusions, ask if I can get the patients anything, promote safety by ensuring that the baby and mom are safe. Bed is lowered down for mom. 2 head rails are up. Non-slip socks if she can walk. If she had a C-section, we would promote bed rest because she cannot feel her feet. After that, I will do my concluding actions and go document all my findings. Thank you.